Akbar Shakur. Yalmaz Tahir.
Brian Turner. And Eric Washington.
Kavita?
Yeah. I think you say her doctor.
No, Kavita, Sarah, Dr. Surage.
That is all. Thank you. Thank you, Sarah, Kavita, Dr. Nasser, and Dr. Suraj, as well as Maheen. Next, we would like to introduce someone who you'll become very familiar with throughout the next 16 months.
Yep, because you'll have him every single semester, so don't get on his bad side. Not only will you be seeing him in the classroom, but he will also be supervising your clinics, where you'll get the most hands-on experience.
He graduated from St. George's University School of Medicine in Grenada 30 years ago. Since then, as a diplomat of the American Board of Family Medicine and a fellow of the American Academy of Family Practice, Dr. Kravitz has maintained a private practice in the Capital District of upstate New York. He received his MPH from the Medical College of Wisconsin. Dr. Kravitz is a founding member of the largest primary care medical group in the Northeast.
Additionally, Dr. Kravitz, an associate professor of the clinical medicine at Albany Medical College, taught medical, nursing, and PA students. He also taught pharmacology, physiology, and anatomy at the State University of New York. He is an active researcher and national speaker on the clinical delivery of diabetic pharmacological agents. Please welcome Dr. Kravitz to lead you in the Hippocratic Oath.
Thank you, ladies, for that very kind and overzealous introduction. Dr. Suraj, Dr. Nasser, distinguished guests, moms and dads, colleagues, and candidates. I've been asked to lead you in the Hippocratic Oath, the student oath, which is your oath that will demonstrate a level of professionalism, ethics, moral standing, and this sense of beginning of your life as a physician. I would like for you to all stand. I publicly acknowledge and accept the privilege and responsibilities given to me as a physician in training and dedicate myself to provide care to those who need. I approach all aspects of my education with honesty and integrity, embrace opportunities to learn from the patients, teachers, and colleagues. I will always maintain the highest standards of professional conduct. I will certify only that which I have personally verified, and I will never receive nor give unauthorized assistance on examinations. I will certify only that which I have personally verified, and I will never receive nor give unauthorized assistance on examinations. I will value the knowledge and wisdom of the physicians who have preceded me. I will recognize my weaknesses and strengths and strive to develop those qualities that will earn the respect of my parents, my colleagues, my family, and myself. I will respect the humanity, rights, and decisions of all patients and attend to them with compassion and without bias. I will maintain patient confidentiality and be tactful in my words and actions. I will value the diversity of patients' experiences, cultures, and beliefs because it enhances my ability to care for them and enrich my education.
I will value the diversity of patients' experiences, cultures, and beliefs because it enhances my ability to care for them and enrich my education.
I will not forget that there is an art to medicine as well as a science, and that the warmth, sympathy, and understanding are integral to patient care.
I will not forget that there is an art to medicine as well as science, and the warmth, sympathy, and understanding are integral to patient care.
I will strive to earn the trust of my patients placed in me and the respect that the society places upon my profession.
I will strive to earn the trust of my patients placed in me and the respect that the society places upon my profession.
I will recognize the privilege afforded to me and as a physician in training and promise not to abuse them.
I will recognize the privileges afforded to me as a physician in training and promise not to abuse them.
Even as a student, I have a responsibility to improve the standard of health in my community, to increase access to care to the underserved.
Even as a student, I have a responsibility to improve the standards of health in my community, to increase access to care to the underserved.
And to advance medical knowledge, as I accept these new responsibilities, I will not forget the importance of my own health and well-being.
And to advance medical knowledge, as I accept these new responsibilities, I will not forget the importance of my own health and well-being.
I will continue to value my relations with those who have supported me in the past and those who will share my future.
I will continue to value my relations with those who have supported me in the past and those who will share my future.
Knowing my own limitations and those of medicine, I commit myself to a lifelong journey of learning how to cure, relieve, and comfort with humility and compassion.
Knowing my own limitations and those of medicine, I commit myself to a lifelong journey of learning how to cure, relieve, and comfort with humility and compassion.
I make these promises solemnly, freely, and upon my honor.
I make these promises solemnly, freely, and upon my honor.
Congratulations. Job well done.
Congratulations, new members of IAU, on receiving your white coats and welcome to the family. This next speaker will make sure that you are all always together.
Don't worry, guys. You'll get that joke in a couple of semesters. Dr. Rashid Agbula holds medical licenses in Grenada and Nigeria. He earned his medical degree in medicine and surgery from prestigious Ahmadu Bello University in Nigeria. And he was also at St. George University in Grenada for teaching and research fellowship program in pathology.
Dr. Rashid was full-time faculty in the pathology department at St. George's University for many years, and he was the assistant professor of pathology at the Atlantic University School of Medicine prior to joining IAU. We would like to welcome Dr. Rashid.
Yeah, we are together tonight. The Dean of Basic Science, Dr. Nasser, the distinguished guest, Dr. Suraj, my respected colleagues and staffs, the inductees, the family members and friends. White coat ceremony. Yeah. Physician has been wearing white coat for many years, for many decades now. But this ritual of white coat ceremony all started in the United States of America, to be specific, University of Chicago School of Medicine. But the first formal ceremony took place in Columbia University School of Medicine. That was many years ago. But this has been practiced all over the world now, not limited to the United States alone, Africa, Europe, Caribbeans, throughout the world. But not limited only to physicians or medical students, also the paramedics. And the significance of this ceremony is not all about taking oath. It comes with responsibility, okay? It signifies or symbolizes the conversion of a lay person to an healthcare professionals in which you are from today. And also, it's more or less like synonymous to induction or ordinance of priest to priesthood. Okay, that means from today you see yourself as a doctor already. Okay, that means, and it comes with responsibility. That means you come with responsibility, the way you carry yourself right from today. The way students or the people, your colleagues, your family, your friends, your neighbor, and even the St. Lucians see you. They see you as a doctor. Only us as a faculty here that we know you're students. That means you must carry yourself with dignity and pride. And also, the white coat ceremony, it's a very important aspect in which now is being conducted, I've already said, throughout the world, in which some schools conduct it prior to the movement or transition from the basic sciences to the clinical side of medicine. But from some schools like ours, in which we introduce our students to patients early in your career. Like from next week, you'll be seeing patients. They conduct this ceremony early before you start seeing patients. And from now on, I will employ you to carry yourself with dignity and pride, to make your faculty proud, to make yourself proud, to make your family proud, and to make the IAU and the St. Lucia proud. I wish you all the best. Thank you.
All right, so are we all together? Yes! Come on, guys, you can do a little bit better than that. Are we all together? Yes! There we go. Okay, thank you, Dr. Rashid. Next, our guest speaker holds the chair of Caribbean Association of Medical Councils, which ensures that the region's medical practitioners and facilities are of the highest standards and quality and are able to provide the most advanced health care.
Appointment to such a high office set the trend for the rest of his professional life.
Following the completion of his undergraduate career at the Queen Elizabeth Hospital in Barbados with a bachelor's degree of medicine and bachelor of surgery, Dr. Suraj then interned at the Queen Elizabeth Hospital before moving to Accident and Emergency Department. Dr. Suraj was instrumental in opening 2 Alcoholics Anonymous centers and a cancer screening program in the south of St. Lucia.
He continued his postgraduate education in Barbados, where he received training in his field of specialty, ear, nose, and throat, and pursued postgraduate training in this field in Edinburgh and Glasgow in the United Kingdom, resulting in his attainment of the Fellowship of the Royal College of Surgeons in ENT Surgery.
This qualification is the recognized postgraduate qualifications in the British Commonwealth. Since graduating, he has continued to remain current by attending academic meetings and workshops internationally on an annual basis. In 2009, he became the International Fellow of the American College of Head and Neck Surgery. Please welcome Dr. Leonard Surage.
Thank you for all these kind words. I can hardly recognize myself when I listen to these things. Protocol has been established. I recognize the presence of Dr. Kravitz, Dr. Buddha, and Dr. Nasir. Sorry if I stumble on the pronunciation. I wish first and foremost to welcome the students on the opposite side to this honorable profession, the career in medicine. They always say, with power comes responsibility, and responsibility must be taken seriously. And that is the standard that we aspire. And you must always be internally critical of yourself, not to depress you, of course, but then enough to make you go. The path you have chosen is like a roller coaster for those of us who have been there. Sometimes the studying is hard and you feel you're going uphill. Sometimes it is quite easy and you're enjoying it. And sometimes you begin to question yourself whether you possess the intellectual capacity to do it. But all of us did it, and you will get through and you will do it, but sometimes it makes you begin to question yourself. But at the end of the day, all of us have gone through it, all of us has passed, and so will you. So just take comfort in the fact that when the road is rough, there is always the tendency to internalize and feel a little depressed. But don't let this worry you. Just talk to your teacher, talk to your colleagues, etc., and you'll get around that. And as I said, the standards, sometimes you may enter into training and realize, especially the more mature students, they tend to begin to wonder, well, why am I learning this? I'm not going to need this. Especially the anatomy and how this little artery and the vein pass around the bone and stuff like that, or in the critical areas in the forearm and how the trigger finger operates. And if you want to be a brain surgeon, you don't really want to know about trigger finger. However, you are doing a basic medical program and you have to absorb everything they put onto you. That is how you develop standards. And all of you all in medical school now are coming from